Hello again, Brian Boehme, physiotherapist at Elite Sports Medicine, and I am joined by the best sports medicine doctor east of the Rockies.
Mike Galbraith, family and sports medicine physician. I hope that's who you're referring to.
Yeah, for sure.
Good.
I want to clarify that yes, that is the case. Yes, we are going to show you, in combination with one of the other exercises, videos that we did, some simple stretches, some simple good stretches, but also a couple of strengthening exercises for somebody that maybe suffers from plantar fasciitis or fasciosis, as you had mentioned.
Say that 10 times fast, yeah.
I don't want to even try for certain reasons. But I'll just say this.
Oh, and even Achilles, a lot of Achilles issues,
I was just going to say that. There's other reasons that you would do it for, but that's in this sequence of videos. That was one of the things we talked about. But I agree, it's a benefit in other areas as well.
Yeah.
So we're going to have the cameraman back up just a bit. I'm going to be the foot model again, and Mike's going to explain a little bit about what I'm doing.
You betcha. So this will be good. So this is great flexibility for the back of the calf down into the Achilles. So I'm going to squat down just a little bit. There's a few different ways to do this. So Brian, which side are you going to stretch?
This one right here.
Notice he has that side kind of pointing towards the wall. And so he's going to lean in. As he's leaning, he has a bent knee, first of all. So as he's bending that knee, where do you feel that?
Just a simple stretch, kind of coming right through here. I would say just a little bit of I can feel that pressure on my ankle just because it's folding a little bit as I put the weight into it.
So that specific stretch will stretch part of the calf area called the soleus muscles, what it tends to target. Now, how is it different if you straighten your leg then?
To straighten my leg, just on this one would be maybe from my back leg right here. So I just turn it in typical runner stretch. Most people know this one.
Right.
Real simple, but I'm feeling it higher up the calf into the gastroc.
Right there.
Yep.
So notice the first one, knee bent, second one, knee straight. Those are great exercises, and we really recommend doing those nice, slow controlled for maybe 10 seconds or so.
That's a good
Fantastic for flexibility.
Yep.
After that, maybe we should head to the stairs.
Sure.
We're going to go to the stairs and really light things up here. We're going to try not to step on our cords. Fantastic. So again, flexibility is great. Now this could be for flexibility. I'm going to kind of drop down by Brian's feet, and I'm going to take life in my own hands here.
You will.
Yes. So now let's have you lower your heels down. So if Brian slowly controlled lowers his heels, this could be just a good stretch if you leave it like this. And it'll fill all the way up through the Achilles, all the way up through the calf with the gastroc and soleus muscle complex. Now, if we want to turn this into what we call an eccentric exercise, notice he goes up, that's called concentric, where that muscle shortens. Now let's go down and lengthen it. This is a great exercise specifically for Achilles injuries. So an Achilles chronic tendinitis, like a tendinosis, or maybe if someone has some very small partial tearing in their Achilles, more down in the kind of chronic phase, this can really be helpful for rehab. Now, what if we do like a single leg, more aggressive? Let's say you go up on 2 feet.
You're asking for lots.
I know. Brian's leg model's kicking in. Now he's going to lower down on that, let's say the injured side. Many people keep that leg straight, just like Brian is very obediently doing. Then he goes up on, there we go, 2, and many people will help and go up on 2 and down on 1. Now, if you want to augment this, we'll add a lacrosse ball. So maybe we can find a lacrosse ball around here somewhere. Perfect.
Excellent.
Look what I found. And Brian likes to do this to kind of help keep that foot neutral so the arch doesn't collapse in when you're kind of lowering that heel down. Just a real simple trick. It's kind of slippery. You said you like to use patients wearing shoes a lot doing this too.
Just more or less just for comfort on the foot itself. It can be a little bit tender to have your bare feet on a stair like this. If it's carpeted, it's not as bad. But I just say more for pain relief, so you're not hurting your feet as you go up and down.
Great. So notice, up, and then he's slowly lowering down. Notice it's slow, controlled motion, right? Nice, slow, controlled motion. So this can be an eccentric exercise as well. And then it just helps maintain that neutral arch. Awesome. Yeah. Any other fine-tuned tips about that, Brian?
No, I feel really good about that one.
That was great. So again, a lot of these are some really key important exercises for plantar fasciitis, just foot and heel pain, Achilles pain. We use a lot of these exercises for Achilles injuries, gastroc injuries. And I think to really get the most out of these, as we've said in other videos, make sure your mobility is good. Make sure your gait, like we have a video on proper gait training, biomechanics, ankle biomechanics, etc. So anyway, happy, strong feet, Achilles and gastrocs to you. Have a wonderful day.
Good weekend too.